Hello and welcome to Medical Dialogues. I'm Dr. Bhumika. Let's look at today's top medical news. Modified insulin with on-off switch may prevent sudden hypoglycemic episodes in diabetics. A modified insulin that can prevent sudden drops in blood sugar has been demonstrated in laboratory experiments and animal models, reports a paper in Nature. This could provide a more flexible way to supplement insulin for individuals with diabetes and reduce sudden drops in blood glucose. Researcher Rita Slaby and colleagues present a modified form of insulin with activity that varies according to the level of glucose in the blood. The molecule, named NNC2215, is equipped with a switch that can open and close in response to glucose. Under high glucose concentrations, the switch opens and the insulin becomes more active, removing glucose from the blood. When glucose levels decrease, the switch moves to a closed state, which prevents glucose uptake. New handheld X-ray device may enhance early detection and treatment efforts in TB. Indian Council of Medical Research ICMR Director General Dr. Rajiv Bahl spoke about new projects and achievements in public health and highlighted a significant advancement in tuberculosis diagnosis. A new handheld X-ray device developed for screening TB, enhancing early detection and treatment efforts, ultimately improving public health outcomes. Two blood proteins may help predict women's risk of developing preeclampsia. A simple blood test could help doctors identify women in labor who are at risk for preeclampsia, a leading cause of maternal death, and take precautions to prevent it, according to research presented at the Anesthesiology 2024 annual meeting. Researchers have determined doctors can predict a woman's risk of developing preeclampsia by calculating the ratio of two blood proteins, that is fibrinogen and albumin, measured in routine blood tests done when women in labor enter the hospital. Fibrinogen is involved in blood clotting and inflammation, while albumin helps maintain fluid balance and carries hormones, vitamins, and enzymes throughout the body. Both can be disrupted with preeclampsia. Fibrinogen may be elevated, albumin may be reduced, or both can occur. There is no universally established normal value for this fibrinogen to albumin ratio, which can range from 0.05 to 1 or higher. Higher fibrinogen to albumin ratio values are often associated with increased inflammation, infection, or serious health conditions, and the higher the fibrinogen to albumin ratio, the greater the concern. This trend has been consistently seen when fibrinogen to albumin ratio is used to evaluate other inflammatory conditions such as rheumatoid arthritis, cardiovascular diseases, and inflammatory bowel disease. Listen to music for an early recovery post-surgery, highlights new meta-analysis. Listening to music may help patients recover from surgery through a lower heart rate, reduced anxiety levels, less opioid use, and lower pain, according to researchers. A reduction in cortisol levels when listening to music may play a role in easing patients' recovery, according to a meta-analysis presented at the American College of Surgeons Clinical Congress 2024 in San Francisco. When patients wake up after surgery, sometimes they feel really scared and don't know where they are, said Eldo Frezza, professor of surgery at California North State University College of Medicine. Music can help ease the transition from the waking up stage to a return to normalcy and may help reduce stress around that transition. Frezza and study co-authors noted that unlike some more active therapies such as meditation or Pilates, which require considerable concentration or movement, listening to music is a more passive experience and can be incorporated by patients without much cost or effort almost immediately after surgery. Thank you for watching Medical Dialogues. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.